Thank you, Mr President. As Labor spokesperson for the electorate of Camden, I want to speak to the report and the ongoing problems the residents of Sydney South West continue to face when trying to access essential health care, which the report directly went to. The current and future provision of health services in the South West Sydney Growth Region Upper House report was damning and found that health and hospital services across the South West have been subject to historic levels of underfunding. The report clearly detailed that people living in South West Sydney and Western Sydney face much longer waiting times for essential health services than other parts of Sydney and are forced to travel long distances for care that should be local, and that medical staff face shortages of key equipment. The inquiry found that more must be done and without delay to address the historical underfunding of health services in the region, including more must be done to address immediate shortfalls in staffing and equipment, and that adequate numbers of medical specialists, nurses and other health workers were needed. The government released its response to the report on the 28th of May 2021. Unfortunately, in all that time, the Liberal and National government has done next to nothing to improve the horrendous state of health services in South West Sydney. Despite the comprehensive inquiry that took place and the scathing report, it is appalling that understaffing and the lack of adequate funding for hospitals in South West Sydney, including Camden Hospital, has resulted in patients facing substantial obstacles to receiving equitable access to health services. We know that many patients are forced to travel outside of South West Sydney to city hospitals for basic health care. This is disgraceful. They should be able to access health care close to their communities and where they live. It is not fair that diagnoses and treatments are delayed for children in Camden and surrounding areas due to chronic underfunding. It has become a highly serious situation and residents deserve better. With the high growth rate in South West Sydney, the underfunding and under-resourcing needs to be urgently addressed. It can no longer be ignored by the Liberals. The residents of South West Sydney should not be treated like second-class citizens. They need access to health services. The state's population targets up until 2041 show that Camden would grow by 180,000 people. We know that the Liberals have not undertaken the proper planning for the necessary health infrastructure in the area. The government has not funded and resourced the health services, including having enough staff to keep up with the pace of demand in the area. Just today, in South West Sydney, residents have been left without intensive care paramedics because the government refuses to resource our health system adequately. Usually, there is one dedicated intensive care paramedic vehicle available during the day at Campbelltown, which is the only one for south of Liverpool in South West Sydney. This is extremely dangerous and has an enormous impact on patients needing specialised paramedic care. Our intensive care paramedics are vital. They undertake highly specialised work, including newborn resuscitation and dealing with cardiac complications. They cannot simply be replaced by paramedics without the specialised training because of the penny-pinching Liberals and Nationals. COVID-19 cases are still very much an issue impacting our ambulance network and hospitals. The New South Wales government should be investing more into intensive care, not decreasing patient access to life-saving care. Paramedics are crying out for help and they feel that the government have simply been ignoring their warnings on safety. Our paramedics are overstretched and are under enormous pressure, with fewer paramedics on the road today. This places residents across South West Sydney at risk. The pandemic has also exacerbated the already extensive issues with health services that were documented in the report. Recent BHI data revealed that 60.3% of T2 emergency patients had their treatment start on time. This is the lowest of any October to December quarter since BHI began reporting in 2010. Without adequate resourcing from the government, ambulance response times have continued to worsen. The most recent BHI data demonstrates that across Campbelltown, the median time it took an ambulance to reach the highest emergency cases has risen to more than 14 minutes. This is not acceptable. Our patients seeking emergency care should be able to rely on accessing treatment quickly. It is time the government urgently paid attention to the report and the current state of health services in South West Sydney. They are underfunded, understaffed and completely under-resourced. The health workers and the residents of South West Sydney are tired of being ignored and they deserve better from the Liberal and National government. Commend the report to the House.